I'm Tony Yancey, and I'm a professor in health services here at the School of Public Health at UCLA, and I'd like to talk with you a little bit this morning about physical activity. Physical activity is a relative newcomer to cancer prevention and control. We have very good evidence for certain cancers like colon, breast. We know that there are elements that may have a particular effect on GI cancers, like decreased GI transit time that decreases carcinogen exposure, enhanced immune function, lowered levels of reproductive hormones, and possibly decreased inflammation. But what I'm really going to focus on in my talk is how we get people up and moving. We've been pursuing some approaches to promoting physical activity that really focus on organizational settings. So getting captive audiences of people where they are, where they're not going out of their way for it, and engaging them in short physical activity breaks. We call them instant recess breaks, because that frames it as something that people usually want and have positive feelings about. And also have integrating other strategies into the workplace, into schools, religious institutions, and others that make the active choice the default option. In addition to these activity breaks that I mentioned, restricting nearby parking spaces for disabled people, scheduling walking meetings or scheduling meetings at a distance from the working units so that people actually have to walk to get there, promoting stair use and deterring elevator use, and also encouraging, incentivizing mass transit. But the point is, physical activity can actually be quite enjoyable. And if we're really going to prevent cancer and other chronic diseases, we've got to make that combination of a healthy diet and a lot of varieties of physical activity. Now, here's some of the good news. People are not getting very much physical activity at the moment, and very little physical activity will make a difference. So 3-minute bouts of physical activity 10 times a day lower serum triglycerides to the same extent as one continuous 30-minute bout. The number of bouts of physical activity has been associated with overweight. So in other words, the more times people are up and moving, the less likely they are to be overweight. And that's not only in youth, but also in adults now that we've demonstrated that. And sedentary behaviors like television watching, as well as not getting enough physical activity, contributed to diabetes and obesity risk over a 6-year period in women. This was from the Nurses' Health Study out of Harvard. So, in other words, those women that just did a little bit less sitting down, a little less television watching, and more light housework or just moving around, actually had fewer incident cases of diabetes. This is a little of the data from a pilot study we did in 25 sites with about 400 people, mostly middle-aged women of color, mostly obese, and mostly abdominally obese. And what we found is that blood pressure decreased slightly. Not huge changes here, because this is prevention, but it increased slightly in the control group over 6 months. BMI didn't change, 0.01, that's really no difference. But it did go up, 0.4 BMI units in the control group. That's about 2 or 3 pounds. So again, this is about the prevention aspect. Most people are not yet obese, thankfully, and we can prevent normal weight people from progressing to overweight and overweight people from progressing to obesity. Most experts agree right now that unless we get the physical activity levels up, you can't restrict diet enough and still maintain all of the nutrients, especially the phytochemicals needed for cancer prevention. You can't get the diet, down low enough with so little activity being expended. So hopefully we're going to, be catalyzing this over time, getting a lot more movement going. And I'm going to actually stop there